when to perform the surgery is also one of the important issues. If the surgery is performed too late, as mentioned earlier, the risk of pneumonia increases, and there is a possibility of developing lung cancer. However, performing the surgery too early also presents challenges. If the patient is too young, their condition might be weak, leading to a higher occurrence of post-surgery complications. Therefore, recommending surgery too early is also difficult. Consequently, it's essential to strike a balance and choose the right timing for the surgery. Finding the right timing means identifying a period with fewer surgical complications and the best potential for lung function recovery. When I explain this to caregivers, I often mention to them that cutting the lungs in younger children is like trimming a plant, as they do indeed grow back. This isn't a lie. There is a substantial body of research supporting this phenomenon. In the left study, the horizontal axis represents age, and the vertical axis represents the number of alveoli. Such studies were primarily conducted using human cadavers in the 1960s or 1970s. As you can see, the number of alveoli increases as age advances, particularly in younger ages. Furthermore, in the right study, a study utilizing helium MRI to confirm new alveolus formation between the ages of 10 and 20 is shown. This study also confirms that alveolus formation continues even after the age of 10. However, our targeted age group is the younger age range where alveolus formation occurs effectively, as depicted in the left image. We believe that if surgery is performed in this age range, it can to some extent offset lung volume loss. Therefore, early surgery in younger ages is recommended. There are several studies that provide evidence supporting such early surgery. These studies measure the residual volume after surgery in patients who underwent surgery at a young age compared to those who did not. A higher residual volume indicates increased dead space ventilation, suggesting that an increase in lung volume is not significantly beneficial for function. In other words, the expanded lung consists mostly of emphysema portions. There is also a similar study where surgical outcomes were evaluated through nuclear medicine research, measuring how quickly radioisotopes are cleared from the lungs after surgery. A slower clearance rate can indicate more severe emphysema. According to this study, receiving surgery before the age of 1 shortens the transit time, leading to a preference for undergoing surgery at an early age, as indicated by the study's results. In the end, the significance of such studies is that children who undergo lung removal surgery tend to develop a larger functional lung with less emphysema as they grow, particularly when the surgery is performed at a younger age. This justifies the rationale for undergoing surgery at a young age. However, such a phenomenon is not observed in adults. In the case of this patient, who underwent surgery at the age of 3, CT scans and lung function tests were conducted at the age of 7, all of which showed normal findings. In this manner, in the case of children, lung function can be perfectly preserved. This patient is an extreme case. They had a very large congenital pulmonary airway malformation, CPAM, and underwent surgery as a newborn. After the lung resection, only a very small portion of lung remained, leading to doubts about whether this lung could properly grow. However, after 5 years, the size of the right lung had almost normalized, and it was evident that it was well balanced in comparison to the left lung. This experience indicates that the regenerative capacity of children's lungs exceeds our imagination. All of these experiences suggest the advantages of undergoing surgery at a young age. So, in conclusion, when performing surgery for congenital pulmonary airway malformation in children, it is recommended to undergo surgery as early as possible, as it is advantageous for lung function. According to guidelines, it is generally recommended to have the surgery done before the age of 2.